Making proper lifestyle changes into health usually include changing your thinking, your eating, and your activity. With regards to the activity, I think that most patients that I encourage to make those 3-month changes and then summit will usually have a very good goal. When you're first starting out, it's hard to figure out how nutrition plays in, and you usually go back into bad habits when you get back into work. But if you exercise 2 to 3 times a week, I think it's important for the day to 2 days of following during that recovery phase for muscle that you provide good building blocks. And that would, I think, speed up recovery phase, probably decrease your delayed onset muscle soreness to only a couple hours to one day, hopefully. Depends on how much you exercise too. But what's felt in the short term more than the delayed onset muscle soreness and your bad or good nutrition is dehydration. So it's really important. I wanted to use this tutorial to talk about rehydration. It used to be that you were just supposed to drink fluids after exercise and that's it. But the ACSM has come up with, even the IOM has come up with more suggestions that if you exercise, I'll just summarize everything that I've come up with. To make it easy for my patients, I usually say if you exercise less than 30 minutes, 60 minutes or less, then you want to take in at least 4 ounces of fluid, water, about every quarter of an hour. 4 ounces every quarter of an hour. That's easy to remember. There are some factions that say 3 to 8 ounces. It's confusing, and it also depends on what you're doing, how aggressive it is, what the barometric temperature is, what the temperature of your body is. So I just make it easy. 4 every quarter. So if you do that, I think you'll maintain a pretty decent hydration status. The concept is that if you just drink water, it is healthy. You might, if you overhydrate and you can overdrink, you might change around the water and the sodium percentages in your body. That will lead to seizures and headaches and confusion. So it can happen with ultra endurance or endurance sports. But again, my rule of thumb, 60 minutes or less of exercise. Doesn't matter what kind of exercise. 4 ounces of water every quarter of an hour. If you go 60 minutes or more, you might want to take 4 ounces of electrolytes or combination fluids every quarter of an hour. And for me, when I hike and I have a heavy backpack on, in fact, this is what I usually carry with me on my big hikes. This is about 2 liters. Comes out to about, it's about 2 gallons, I'm sorry. Comes out to about 12 pounds or more. And at the beginning of my hikes, this thing will be heavy. Towards the end, when I'm hydrating off this thing, it'll be lighter, but that's just it. If I have to pull it out every 15 minutes, I'll be wasting time. If it takes me 5 minutes to put my backpack down, take my water bag out, take water, reset it, put my backpack on, out of a 7 to 10 hour hike, that could be a lot of time. So I try to sometimes space it out a little bit. I'll do 8 every 30 minutes, or worst case scenario, 16 every hour. The only problem with taking a lot of volume at once every hour is sometimes the stomach gets irritated, especially if you use electrolytes, hopefully low calorie, electrolytes and or protein. And that leads me to my next thing. If you have choices and you have water, great. If you have natural fruits, I think that's even better. But if you're going with the science of trying to have a little bit of electrolyte, sodium, potassium, the suggestion now is protein also helps get fluid into cells. It changes something called the osmolarity of the fluid in the gut, and if the fluid osmolarity in the gut is equal to the fluid osmolarity in the cells of the stomach, the small intestine, the colon, you'll have the movement of fluid in and out of the wall a lot easier. That's the suggestion. Now, it's going to be hard for me to carry this many cans or this many. If I was to dump all this in there, it gets sticky in there. This is coconut water, but this is coconut water with the lining of the coconut or the pulp of the coconut in it. It's imported, but these imported cans are heavy. I just like the taste, and I think it's more natural than taking the energy drinks or some of the protein supplements or the fluids rehydration plans or suggestions. So they're also expensive. If you can rehydrate with something that has 4 grams, again I'm going to summarize it because it's easy for me to remember small numbers, 4 grams of protein in about 4 ounces of volume every quarter of an hour, then that will probably keep you honest during your endeavors into hiking, into marathon training, into any kind of continued exercise or a sporting event. Now if you throw in caffeine, I'm okay with, and I follow the exercise physiologist out of UCF that I used to work at as a sports medicine physician, Jay Hoffman. He did his study on caffeine beforehand, and it did not increase the feeling in the athlete, but it did increase the amount of reps and the power that was expressed in the exercise, peak exercise during 4 sets. So caffeine does help, but the problem with caffeine is sometimes caffeine will also act as a diuretic. It'll make you pee. And then caffeine's other side effects, which can be abated if you exercise enough. The other side effects of caffeine are it irritates reflux. It also screws up with your sleep later on if you exercise late in the day. It'll also increase blood pressure a bit, and it can mess around with triglycerides sometimes. But if you take a little bit of caffeine and you really exercise and relax afterward, practice relaxation techniques after your exercise, so you not only have an endorphin and enkephalin high, you also have a serotonin high. I think that'll negate your caffeine intake, but again, some of you who need a little bit of a boost, fine, but just try not to do those. If you're going to go with caffeine, try not to do the ones that are in Red Bull or those high sugar drinks, sports drinks. I think they're bad for you in the long run, and they're a little addictive too, especially because of the sugar. It'll cause a glycemic high and then an insulin dump afterward, which will screw up your muscle building and your sugar availability, so be careful. The suggestion with fluid is always to continue with what we talked about as far as hydration afterward. Maintain the fluid response during your exercise. Replenish after, and there's a formula by the ACSM as far as figuring out how much you're supposed to be taking in. You take a couple of exercise days, you weigh yourself in the morning, you get that as your baseline weight, and then you get your weight after you exercise, and you can calculate how much water you lose in an average exercise routine, and you make up the difference. I believe it's 1.5 liters for every half kilo of weight loss. I'll put the formula here. It's a little bit confusing. If you're getting to that point, you really should hire either an exercise physiologist or come to me for specific calculations. If this is all confusing to you, don't let it be. The bottom line is that you should maintain hydration. Probably should cut your fluids before dinner, that way you're not peeing all night. And if you are just doing what some of my videos suggest as beginning a walking program, you want to try to maintain a good hydration status. The easiest thing to remember is, I'll put a link to how much an average female should get in 24 hours and how much an average male should get in 24 hours, and you stick to that. If you stick to that at a minimum, and then kind of throttle or change your response depending on how much exercise you do during your exercise days, I think you'll be fine. So if you have, if it's more questions than this video or tutorial can answer, you really need to get help, especially if you're on medicines like water pills or beta blockers. It changes around a couple of things with regards to heart rate. You'll never get your heart rate up if you're on a beta blocker. Ask your doctor about that. And if you are on other medicines that are kind of confusing, like sugar medicines, you really should be careful about hydration. Very careful, and that's where you have to go back to your doctor and get the clearance first in the pre-exercise or pre-participation physicals. But ask for guidance. I think that's the easiest thing you can do is ask your doctor if you're unsure. Don't go by everything you read on the internet. It's very confusing. Even to me, I scrutinize a lot of studies, but it's still confusing to kind of sift through and see who's credentialed and who gives the good trials or who follows the good trials, who's just giving the advice out there that's somewhat dangerous.